Do you ever notice a strange tingling in your feet that just won't quit? Maybe painful cramps jolt you awake at night, or your legs feel like, I don't know, lead weights by dinner
Oh,
time?
definitely. And it's so easy to dismiss those things, isn't it?
Yeah,
You just chalk it up to a long day or maybe just getting older.
right. But our source material for this deep dive, it suggests they could actually be early signals you really need to pay attention to.
Uh-huh. We're looking at this YouTube transcript, Welcome to Health Aura,
Hmm.
and it makes a pretty strong case that these, seemingly minor annoyances aren't just discomfort.
They could be silent red flags, warnings about poor circulation, maybe even the risk of dangerous blood clots.
And what really stands out, the source points this out clearly, is how often these critical early symptoms are missed or just written off.
Until potentially life-altering things happen.
Exactly. Stroke, heart attack, DVT, things you really want to avoid.
But the vital message, and this is woven right through the source, it's one of proactive power. It says you can take meaningful action before those serious issues strike.
And that's our mission today, right? To unpack this specific source, pull out the most important nuggets of knowledge, and help you get well-informed quickly on this really vital topic.
Yeah, we're going to look at the body's own warning language, just like the source presents it, and then explore the natural support it highlights. Things that could make a big difference in keeping blood flowing healthily.
Sounds good.
Okay, let's unpack this then. The source dives straight into what it calls crucial early warning signs, signals your body sends about potential circulation trouble that, well, we often miss or ignore.
Yeah, what's fascinating here is how the source kind of elevates these things.
Yeah.
Sensations or appearances you might think are minor,
Mm-hmm.
it reframes them. Since they're not just cosmetic, not just normal aging, they're potentially clinical evidence pointing towards, deeper vascular issues.
Okay, so the first sign it spotlights is changes in skin discoloration.
Yes, exactly. You might notice areas on your legs or maybe your feet that look unusually pale or bluish, maybe even have dark patches.
And the skin might feel cold too.
Often feels noticeably cold to the touch, yeah. And the source explains why. It's down to poor blood flow.
Right.
Healthy blood carries oxygen and warmth. If circulation is sluggish, oxygen isn't getting to the skin tissues efficiently. That causes those color changes in the cold spots.
So the source is pretty direct. This isn't just how your skin looks. It's a visible sign your vascular system is under strain.
Mm-hmm. And linked to this, the source also notes slow wound healing.
Ah, okay. Like if a small cut takes forever to heal.
Precisely. That slow recovery can be another red flag, because good blood flow is absolutely essential for delivering nutrients, oxygen, immune cells, everything needed for repair.
So if circulation is bad, the body just struggles to mend itself.
Exactly.
Mm-hmm.
Which also increases the risk of infection.
Mm-hmm.
So dismissing persistent skin changes or that slow healing is just part of getting older, the source really emphasizes that could mean missing a critical early warning.
Okay, that makes sense. Which brings us to another big sign mentioned, cramps, especially during walking or at night.
Yeah, this is really interesting. The source highlights those painful muscle cramps that hit specifically when you're active, like walking. Intermittent claudication, that's the term.
Right.
But it also points to those awful spasms that can strike when you're resting, even waking you up at night.
So what's the explanation given for that?
Well, the source puts it quite vividly. It's your muscles crying out for more oxygen.
Okay.
See, if arteries are narrowed or blocked, blood flow gets restricted. During exercise, muscles need more oxygen. If they can't get enough because of poor circulation, they cramp up.
And night cramps.
The source suggests those can be even more concerning. They signal impaired flow even when your body's at rest.
So ignoring this, the source says, points towards underlying vascular insufficiency. And it's clear this is a major risk factor for things like peripheral artery disease, PAD, and importantly, for dangerous blood clots forming.
That's a pretty strong signal your vascular system is struggling.
Definitely. Okay, a third sign the source gets into is frequent tingling and numbness, that persistent pins and needles feeling.
Yeah, we all get that temporarily if we sit funny, Lim falls asleep.
Sure.
But the source is talking about when it's persistent or happens often, chronically. It says that's often a sign of insufficient blood flow to the peripheral nerves.
Nerves need blood too, obviously. Right?
Exactly. Just like muscles, they need that steady supply of oxygen and nutrients. If the flow is consistently poor, these nerves get deprived, they can start to malfunction. This can lead to something called peripheral neuropathy.
And the source describes a potential progression.
It does. Starting perhaps with mild tingling, but potentially leading to things like diminished reflexes, reduced muscle strength, poor coordination,
Hmm.
even an increased risk of falls.
Wow.
And the warning is stark. If ignored, this nerve damage can become irreversible, really impacting mobility and independence down the line. It's presented as an early distress signal we often overlook until the damage is, well, pretty advanced.
That's quite serious. Okay, moving on. The source calls the fourth sign one of the most telling yet also frequently dismissed, and that's cold feet, even on warm days.
Ah, yes. Seems so simple, doesn't it?
It does. But according to this information, it's way more than just being uncomfortable. It's a direct indicator that blood isn't effectively reaching your extremities.
Your blood is basically your body's internal heating system, right? When flow is reduced, the parts furthest from the heart toes, feet, they feel the chill first. The source points to arterial narrowing or blockage as a common cause, limiting that warm, oxygen-rich blood getting to the lower limbs.
So persistent coldness, it argues, is an early warning of potentially serious vascular compromise.
Exactly. And the emphasis again is, don't just dismiss this as normal aging. Doing that could mean missing a sign that your circulatory system is under significant stress.
And the source warns this can contribute to PA, raise the risk of ulcers, and ultimately even increase the chances of amputation or life-threatening clots. That's a real wake-up call.
It really is. Finally, the fifth sign highlighted is visible varicose and spider veins.
Right. Those bulging, twisted veins, or the smaller sort of red, blue, purple spider veins. Almost everyone sees those as just cosmetic, right?
That's the common view, yeah. But the source directly challenges that. It says they are clear, visible evidence of weakened vein walls and faulty valves inside the veins.
Faulty valves.
Yeah. Think of healthy veins having these little one-way valves, making sure blood flows back up towards the heart efficiently. When these valves weaken or fail, blood can pool. It can even flow backward. That condition is called venous insufficiency.
Okay. And that pooling causes the veins to bulge out.
Exactly. The pooling and backflow increases pressure inside the veins, making them enlarge and become visible. But beyond just how they look, the source stresses they signal poor venous return.
Which can lead to other symptoms.
Yes, impaired circulation like this can cause swelling, discomfort, that feeling of heaviness, fatigue in the legs. And the crucial warning is that ignoring chronic venous insufficiency can lead to more serious stuff. Blood clots, painful skin ulcers, even deep vein thrombosis, EVT.
So they're not just cosmetic flaws, they're visible markers of circulatory distress, according to this source.
That's the key message.
Huh.
So if you step back and look at this whole section from the source, it connects all these seemingly separate things. Skin changes, slow healing, coldness, cramps, tingling, visible veins, and frames them all as potential signals. Signals from your body pointing towards underlying circulatory problems.
It's about understanding they aren't just isolated annoyances, but pieces of information. Your vascular system trying to tell you something's up.
Urging you to pay attention, basically.
Okay, so that's the potential problem side highlighted by the source. But it doesn't just leave us there, does it? What does this mean for taking action? It offers potential solutions, too, focusing on a natural approach.
Exactly. This is where the source brings in specific vitamins, presents them as powerful allies that can help support healthy blood flow, and maybe even address some of the underlying issues behind those warning signs.
Let's start with vitamin B3. The source calls it the vessel expander. I like that.
It's a great description. Niacin, or B3, it's highlighted because it promotes vasodilation. That means it helps blood vessels relax and widen.
Which would improve blood flow.
Yes, potentially improving flow throughout the body. And the source connects this directly to benefits like more efficient oxygen and nutrient delivery to all your tissues, which in turn can help reduce the risk of dangerous clot formation.
Does it mention other benefits?
It does mention niacin's broader role in heart health too, like helping manage cholesterol, lowering the LDL, the bad kind, raising the HDL, the good kind, which helps keep arteries clear and flexible.
And food sources.
Oh yeah, it lists things like skinless chicken breast, eggs, salmon, tuna, almonds, good common foods.
And there's a caution, too, right, about supplement.
Yes, a practical note. High-dose supplements can cause that uncomfortable niacin flush. So getting it from whole foods is presented as a safer way to get a steady intake without that side effect.
Okay, good to know. Next up is vitamin C, which the source calls the vessel protector.
Right. We usually think vitamin C for colds, maybe.
Yeah, immunity.
But this source really emphasizes its crucial structural role in our vascular system. Its key job here is stimulating collagen production.
Collagen, like foreskin.
Yes, but it's also essential for building and maintaining strong, elastic blood vessel walls. Without enough collagen, the source explains, Arteries and veins can weaken, stretch, become more prone to damage, which could contribute to things like varicose veins.
Ah, okay. And it's also an antioxidant.
Potent anti-inflammatory and antioxidant, yes. The source points out that inflammation and oxidative stress are big drivers of vascular damage, promoting plaque and clots.
So vitamin C helps fight that.
By neutralizing those harmful free radicals, yeah.
Yeah.
It helps shield vessel walls, prevent premature aging, keep blood flowing smoothly. The advice is to get it from fresh, minimally processed foods, citrus fruits, kiwi, berries, guava, broccoli, spinach, with a note that it's sensitive to light and air.
Makes sense. The third vitamin is vitamin K, the calcium regulator.
This one's maybe less famous for circulation, but the source makes a strong case. It's vital for regulating blood clotting, making sure clots form when you need them, like for a cut, but preventing dangerous ones inside vessels.
And it mentioned something about calcium, protecting against arterial calcification.
Exactly. That's a really interesting point. Hardening of the arteries due to calcium buildup. Vitamin K, the source explains, helps direct calcium into your bones, where it belongs, instead of letting it deposit in artery walls.
Which keeps arteries flexible.
Keeps them elastic, yes. Crucial for healthy blood pressure and flow. Good sources listed are dark leafy greens, spinach, kale, arugula, also broccoli, kiwi. It even suggests green smoothies as an easy way to get more.
Okay. But there's a really important caution here, isn't there, about blood thinners?
Absolutely critical caution. If you're on blood thinning medication like warfarin, consistent vitamin K intake is vital. You must talk to your healthcare provider before making any big dietary changes involving vitamin K, because sudden shifts can mess with how the medication works.
That's a really, really important point from the source. Okay, finally, vitamin E, called the antioxidant defender.
The source presents vitamin E as essential for shielding your blood vessels from oxidative stress, which it calls a primary driver of early vessel aging and hardening.
So like vitamin C, it protects the vessel walls.
Yes, as a powerful antioxidant, it helps protect the integrity and flexibility of artery walls by fighting free radicals. This can help reduce inflammation, inhibit plaque formation, lower clot risk.
Does it do anything else for blood flow?
The source also notes it helps support nitric oxide production. Nitric oxide helps blood vessels relax, which improves blood flow and can lower blood pressure. Key factors in defending against heart disease and stroke.
And sources for vitamin E.
Things like avocados, extra virgin olive oil, sunflower and pumpkin seeds, spinach, almonds, healthy fats and nut seeds mainly.
And again, a warning about supplements.
Similar caution, yes. High doses from supplements might increase bleeding risk. So again, whole food sources are emphasized as being safer and more effective.
So the big message here is that taking action really matters. As the source emphasizes, these circulation issues, they don't just stay in your legs, right? They impact everything, your heart, your brain, your ability to just move around freely.
Yeah, what might start as cold feet or a leg cramp if you ignore it could be an early sign of much bigger, potentially life-threatening problems. Heart attacks, strokes, progressive vascular disease. The source really stresses that for older adults especially, dismissing these symptoms can sadly lead to a really steep decline in health and independence.
But the positive side, the empowering part that's repeated, is that even small, consistent changes, really listening to your body, making smart food choices, can potentially make a huge difference.
Absolutely. By paying attention to those early warnings and responding proactively, you stand a much better chance of maintaining your vitality, your freedom to move.
So the source offers a simple plan to get started.
A very practical plan, yeah. First, just start by genuinely listening to your body. Pay attention. Track any unusual or persistent symptoms, tingling, cramps, coldness, skin changes. Don't just brush them off.
Okay, then make wise dietary swaps, like it suggested.
Exactly. Simple first steps. Maybe start your day with a green smoothie. Pack it with leafy greens and fruits.
Good idea.
Try replacing processed snacks with nutrient-dense things like almonds or sunflower seeds. Consciously add a serving of dark leafy greens to at least one meal. Choose fresh fruit instead of sugary desserts. Small swaps.
And crucially, talk to your doctor.
So important, especially if you are already having symptoms or if you're on any medications. Getting professional guidance just ensures the steps you take are safe and right for you.
These aren't presented as, like, extreme measures.
Not at all. They're practical, insightful steps drawn right from the source materials analysis. The clear message is, early attention and consistent, simple actions can help prevent things getting worse and potentially lead to real improvements in your vascular health over time.
Yeah. At its core, As the source makes really clear, your circulation is basically the lifeline supporting your health, your strength, your independence. Protecting it isn't just about avoiding future disease.
It's fundamentally about preserving your freedom, isn't it? Your ability to move through life fully, actively, without the limits poor circulation can bring.
The core takeaway seems really powerful. Ignore those subtle symptoms today, you might face much bigger problems later. But take the simple, consistent steps highlighted in this source.
And you can play an active role in safeguarding your heart, your brain, your mobility for years to come.
So, thinking about how this source connects these, seemingly minor physical signals to major health outcomes,
Hmm.
maybe consider the one warning sign we talk about today that you personally might have previously just dismissed. What new perspective does this deep dive maybe offer you on that specific signal from your body?